Welcome everyone to a video about a condition that affects millions of men around the world, benign prostatic hyperplasia, or BPH. What we're talking about is a common condition, especially as men get older, where the prostate gland gets a little larger than it should. This can lead to some uncomfortable urinary symptoms that can really impact a man's quality of life. But the good news is, BPH is treatable, and with the right information, you can take control of your health. So, what exactly are we talking about when we say BPH? Well, imagine a small gland, about the size of a walnut, nestled right below the bladder. Now, as we age, this gland can start to grow larger, and that's when we run into trouble. The urethra, the tube that carries urine from the bladder out of the body, runs right through the prostate. As the prostate enlarges, it can start to squeeze or pinch the urethra, making it harder for urine to flow freely.
Now, let's talk about those symptoms. The most common ones involve changes in urination. You might find yourself waking up multiple times throughout the night, needing to use the bathroom urgently. Then there's the feeling of having to go all the time, even if you just went a little while ago. That's urinary frequency. And when you do go, you might experience difficulty starting the stream, a weak flow, or even dribbling after you're done.
So, what causes BPH? Well, the exact reasons are still a bit of a mystery, but we do know that age is a major factor. As men get older, their hormone levels change, and this can contribute to prostate growth. Think of it like this. Just like our hairlines might recede with age, our prostates might decide to expand a little. If your father or brother has BPH, your chances of developing it increase.
Now, if you're experiencing any of the symptoms we've talked about, don't brush them off. It's important to see your doctor and get checked out. Early diagnosis is key to managing BPH effectively. Your doctor will likely ask you about your symptoms and medical history. They might perform a physical exam, including a digital rectal exam, to assess the size and shape of your prostate. They might also recommend some tests, like a urine test to rule out other conditions, a blood test to check your prostate-specific antigen levels, or even an ultrasound to get a better look at your prostate.
The good news is that BPH is treatable, and there are a variety of options available depending on the severity of your symptoms. For some men, lifestyle changes might be enough to manage their symptoms. This could include things like limiting fluid intake in the evening to reduce those nighttime bathroom trips, avoiding caffeine and alcohol, which can irritate the bladder, and maintaining a healthy weight. If lifestyle changes alone aren't enough, your doctor might recommend medications. Some medications help to relax the muscles in the prostate and bladder neck, making it easier to urinate. Others work by actually shrinking the size of the prostate gland.
While BPH itself is not life-threatening, it's important to understand that if left untreated, it can lead to some complications. One of the most common complications is urinary retention, which is the inability to empty the bladder completely. This can be very uncomfortable and can even lead to bladder infections. Over time, untreated BPH can also weaken the bladder muscle, making it difficult to urinate even with treatment. In rare cases, BPH can lead to bladder stones, urinary tract infections, or even kidney problems. That's why it's so crucial to catch BPH early and get the treatment you need.
When should you see a doctor about BPH? The answer is simple. Don't wait. If you're experiencing any changes in your urinary habits, even if they seem minor, it's always best to err on the side of caution. Early detection is key to effectively managing BPH and preventing complications. Now, the best way to manage BPH is to be proactive about your prostate health. Regular checkups, especially for men over 50, are crucial. This gives your doctor a chance to catch any potential problems early on. Pay attention to any changes in your urinary habits, and don't hesitate to bring them up with your doctor. Remember, knowledge is power, and the more you know about BPH, the better equipped you'll be to manage it effectively. Understanding BPH and seeking timely medical advice can greatly improve quality of life. Most men with BPH can manage their symptoms effectively with proper treatment and lifestyle adjustments. Thanks for watching, and don't forget to subscribe for more health tips.